If a patient comes with a complaint of heavy menstrual bleeding, the two most important questions that you're going to ask is whether she is passing clots, and as the size of clot, if it is more than 1 into 1 centimeter, you definitely have to consider it. And the second question will be the nocturnal changing of the pad, whether the patient is changing the pad in the night. Is it abnormal? Not everyone does it. So this confirms the patient has heavy menstrual bleeding. And coming to the causes of heavy menstrual bleeding, you know palm point classification, that is polyp, adenomyosis, leiomyoma, and the malignancy. All these causes can be seen in the scan. So you send a scan ultrasound abdomen pelvis for a patient, and coin sees coagulopathy, is endometrial causes, and is iatrogenic. All these things can be asked to the patient's history. And now you examine the patient and you check for the pallor, you check for the pulse rate, you will see whether the patient is in the shock. And if the patient is stable enough, you can send the investigations. First investigation is definitely urine pregnancy test, because the pregnancy is the most commonest cause of the heavy menstrual bleeding in a patient of reproductive age group. And the second cause will be a thyroid. It is the most common endocrinological abnormalities. It might be hypo or hyper. So the TSH has to be sent. And the third most commonest cause will be PCOS. So again, we can see the PCOS features in a scan. And how do you treat this patient? In a low resource setting, at first, if the patient comes to your clinic, you please give her a tablet which will stop her bleeding right now. That is, we just give a tablet called as PAUSE. It is tranexamic acid. It is antifibrinolytic, and we can give the PAUSE injection 1 gram up to TAD, or you can give a tablet of PAUSE of 500 mg BD or TAD depending upon the severity of the patient. And now you send all the investigations and let the patient come back with you with all the investigation.